Hello, so in this session I'm going to walk you through the TB module. So before I take you to the TB module, we need to first register a client that you're going to be attending to. So I'm going to click on Workspace, click on Reception, and we're going to register the client that we want to attend to. So his name is Meluleki Khumalo, and he's male, and Meluleki today does not have his ID number with him, and he does not remember his ID number by head. So because of that, I'm not going to enter any form of identifier that he came with. He also does not know his birth certificate number or driver's license number by head. So I'm going to click on search. So the system will still allow us to register a client even if they do not have a form of identification with them. I'll click on search. So here I'm just checking if Meluleki Khumalo has been registered before in our system, and currently there's no record, a similar record. So I'll click on OK and go ahead and register a new client. So I'll put the last name, first name, his male, his birth date, and check demographics. I'm still checking if there's any duplicate in the system, and there are no duplicates found. So I'll go ahead and register and put the self-identifier, marital status, education level, their religion, their nationality, and their country of birth. Then I'll go ahead and click next and put their address here and their town. They are in Bulawayo. Then once I'm done, if you go click on demographics, you realize that we've already entered his demographic information. If he has a form of identification, you can go ahead and edit. If there's contact details, remember we did put the address. We're going to go ahead and put his phone number and click on save. And if he has an email address, you can edit there. If they have any relations that we feel need to be added into the system, I'll add Meluleki's spouse. Her name is Samantha and she's female, and I'll go ahead and search. In our system, we already have a Samantha Khumalo who was born in 2013, but this is not the Samantha that we want to register. Samantha was actually born in 1992. So I am sure this is not the Samantha that we want to register. So I'll go ahead and register a new person. Khumalo Samantha, she's female. She was born in 1991. Then I'll go ahead and check demographics. So in our system, we have someone who has already been registered as Samantha Khumalo, who is female and whose date of birth is 2013. If I click on view, this is not the Samantha that I want to register. So I'll close and confirm that I've checked all possible patients, and I'm sure this is not a duplicate, and then I'll click register. Now I'm going to highlight that Samantha is a spouse to Meluleki Khumalo, and she's a student, and I'll put Samantha's phone number and highlight that she's a next of kin to Mr. Khumalo and they live in the same address, and click on save. So we have added a relation, and if there's any medical aid, you go ahead and click. So I'm going to click on overview and admit Mr. Khumalo in the TB module. So I'll click on admit outpatient. I want to admit them into the TB unit, and then I will send to queue. And if I'm the one who's going to be attending to Meluleki Khumalo, I'm going to click on attend to patient. If I'm not the one who's going to be attending to him, I'm going to click on close. So since I'm the clinician who will be attending to Meluleki Khumalo, I'm going to click on attend to patient. And because in this particular video we want to go through the TB module, I will just do vitals, Meluleki vitals, then I go ahead and go to the TB module. So I'm going to go to vitals and add his blood pressure. Don't forget to click record, add his temperature, and I will record, put his pulse. I hope this is a normal pulse. Put his respiratory rate and click on record. If you record their height, remember to capture it in centimeters and their weight. Then I'll click on save. Then once I'm done with the vitals, I'm going to click on close. So now I'm going to go ahead and go to the TB module. So I'll click on TB. Do you want to proceed to register client and TB module? I'll click on yes. And these are the patient demographics that we entered. And I'm going to click on next and highlight the registration date, which is today. The referral category, I'll click the one that I select. Does the client have a current TB number? In my instance, they do not have. If they do have, you click on yes and you put the TB number. So my client does not have a current TB number, so I'll click on no. And the patient type, it's new. The type of diagnosis, it was bacteriologically confirmed, and the sensitivity is reef sensitive. And I'll highlight the site of disease and I'll add my diagnosis. So if there's no diagnosis that you want here, you can go ahead and go to page 2 or page 3, or you can actually search. Then I'll select my diagnosis and the date of diagnosis, which is today, and I'll click on save. Now I'll go ahead and put and click on vitals. Remember we captured our vitals earlier, so this is the values that we entered for blood pressure. We entered them at 12:35, the temperature, the pulse, respiratory rate, the height, and the weight. And because of these details, it gives us the patient body mass index. So if you feel you need to do vitals again, you can go ahead and capture the vitals. Give you an example. If I want to capture temperature again, I'm going to put it here and record. It's going to show me that at 12:35 we recorded a temperature of 36.3. At 12:38 we recorded a temperature of 36.4. So I'll go ahead and click on complaints, record my client's complaints. He has a headache which has been going on for 3 days, and then you write notes if any. Then you go ahead and select. If you want to add another complaint, you can go ahead and add. Remember to put the duration and save. Examinations, we're going to examine our patient, so you click on update and quickly examine your patient. Go to the next tab. Go to the next one. So basically you're examining your client as you tick. And then you examine their cardiovascular system. Remember we put the pulse rate earlier. Move on to the next examination. Move on to the next. And once we're done, we click on save, and notification examination successfully saved. So we're going to click on OK and go on to our investigations. If there's an investigation that you would like to do to your client, you can go ahead and record. So I'll record they're due for another sputum test. And I need to send it to the lab because we do not perform it local at our clinic. Click on external, and then I'll search the lab and generate a request number and click on save. If you click on diagnosis, you'll find the diagnosis that we actually captured earlier on. So once you're done entering these details, you're going to click on back, and it will ask us if we want to initiate our client on TB treatment. We're going to click initiate patient, and we select the signs and symptoms. Does the person has liver disease? Currently ours does not have. Pre-existing severe peripheral neuropathy? No. Is pallor present? No. Any signs of jaundice? No. And I'll click on confirm. Then I'll click on OK. So this is our overview. And if you click on assessment, remember we assessed our client. If you click on treatment initiation, we want our client to be initiated. We want them to start today on first line, and the type of DOT is going to be health facility, and we click on save. So once we have saved, you realize that if you click on overview, this is where we are. We did register our client into TB. We did do an initial assessment. We did take vitals. We recorded complaints, examinations, investigations. We gave them a diagnosis. So I'll click on back. TB treatment status. This is the treatment that we started them on. I'll click on back. Then if you have a mobile money program at your facility, you enroll them into the mobile money program. So you're going to click on add mobile money program, and it's today, and you highlight the program name. So I'll just put it as program name here. Then click on save. So we want to enroll them in this program today, and we put their phone number and select the program name and click on save. So we have enrolled them into our money mobile program. So we won't enroll them again, so I'm going to click back, and if they have any TB contacts, we're going to click. So it's showing us Samantha Kumalo because they are related. So if it's a TB contact, then we're going to add contact tracing, and we're going to go ahead and go to TB history, Do they have any medical history? We've given them a diagnosis. Any medication history. Maybe they have been on medication before. You can highlight that. Investigation history. This is the investigation that we took them today. But before they were initiated to TB, they actually once had a sputum test. So I'll record that we once took a sputum test in June on the 2nd, and it was MTB detected. That's why they're actually in our TB module. Then I'll click on TB history if they have any history of TB that our system knows of. Currently, this is a current client, and we're going to click on back. So after clicking on TB history, we're going to go ahead and click on TB risk groups. Is he a minor? Is he a health worker? A prisoner? Have they had any contact with a TB patient? So currently our patient is actually a minor. So that is our TB risk group. Then highlight on TB outcome. This is a current patient on TB, and put today's date. Then I'll click on save. So once you're done, you're going to click on back. So basically what we were doing is we were entering his registration details, initiating them on TB treatment, and we only do this once. Now each time they come for visits, we're going to be clicking on this initiate visit button to initiate our client and highlight their visit number. So today it's they're coming for the first time, so we're going to say day 1. If they're not coming for the first time, maybe it's an old client, you select their visit number. For instance, if it's an old client, maybe they're coming for day 14, you're going to click on day 14 and you start your visit. So once you start your visit, you need to enter vitals, their complaints. In our case, we've already entered. We're going to assess them again for TB. Are they still coughing? Shortness of breath? Do they still have night sweats? Is there any weight gain? Then you click on confirm. So they have been assessed. If there are any adverse events, maybe they've reacted to the medication that you gave them, then you can record that as an adverse event. So I'll just record so that we have an idea. He was complaining of headaches, which could be an adverse event, and it started 2 days back, and it's not serious. And maybe highlight the suspected case. It could be the medication that they're in. Maybe you could continue treatment or withhold or stop treatment. And the adverse event outcome date, and what was the outcome once they recover, and was there a re-challenge. Then you update. So this is basically for adding adverse events. If say our client has adverse events, our examinations we have already recorded for this particular visit. Then our investigations, we have already taken a sputum test sample which we have sent to the lab. Diagnosis, we have already diagnosed our client. If you want to prescribe them with any medication, you're going to prescribe them with rifampicin and isoniazid will give them 30 tablets oral, twice daily. The duration will be for 15 days, and you write notes if any, and if it's a repeat prescription you highlight the counts and you click on save. So if you'd want to dispense it to the client, you're going to click on dispense, and if you're the person dispensing it, you're going to click on dispense. But if you're not the person who's actually going to be dispensing the medication, you're going to leave it blank and go ahead and click on DOT treatment and record the treatment, DOT treatment. So all these, if you look at the bottom, we have so many pages. So all these are the kind of treatments that we have for DOT. So I'll just select any of these and I'll click on save. So the save at the top and the save at the bottom are just the same. So I'll click on save. I've captured my DOT treatment, and once you're done attending to your client, you're going to click on close. So it's telling us that a clinical assessment was not done. If we click on go to overview, this is the overview that we have. Once you're done attending to your patient, you're going to click on appointment so that we give them their next appointment. Click on new appointment. We want them to come next week, same time, and their appointment reason would be for sputum collection or drug pickup. So click drug pickup and click on save. So for this date, we actually currently do not have any appointments that are booked. So I'll proceed to set appointment. And once I've set the appointment, I'm going to click on back. And once you're done with the client, we've set an appointment for them. The TB outcome, they're currently taking their treatment. So once you're done, we're going to click on close and we discharge our patient and go ahead and click on discharge.